Good morning, everybody, and welcome to the Isles of Scilly Local Outbreak Engagement Board. Today, Tuesday, the 12th of January, 2021. This will be a virtual meeting with remote attendance by councillors and remote access of press and public. And will be held in accordance with the provisions of the local authorities and police and crime panels, coronavirus flexibility of local authority and police and crime panel meetings, England and Wales, regulations 2020. So, first of all, item 1 on our agenda, we have declarations of interest. Do I have any, please? I'll take that as a no. Thank you. Item 2 on our agenda is minutes of previous meeting held on the 19th of November. I've been through the minutes and don't see any issues myself. Has anybody else got any issues with those minutes, please? No? Then I take it that you're happy that we approve those minutes. Thank you. Item 3 on our agenda is our local outbreak and evacuation plan monthly update, which is in the hands of yourself, Paul. Is that correct? Thank you.
Thank you, Robert. I'll bring Tanya in as well later for some sort of update on testing on the islands. Can I start, please, I'm sure on behalf of the board, in saying congratulations to Rachel for being appointed as our Permanent Director of Public Health. Excellent appointment in my view. Thanks, Rachel. Great to have you on board and look forward to your guidance as ever, going forward, particularly on this meeting. Colleagues, obviously, a lot's happened since the last time we met. The last time we were in Tier 1, and over the winter, the Christmas period, I was involved in a number of conversations at regional level about whether the Isles of Scilly should remain in Tier 1, bearing in mind that Cornwall was likely to escalate away, bearing in mind the numbers, and Rachel will go into that, I'm sure, later. Obviously, government decided and took that away from any regional conversations in the end and decided to bring in the national lockdown. So it was a bit of a shock to everybody that we went from Tier 1 to national lockdown almost overnight. Since that time, we've stood back up again the multi-agency group that works so well on the islands during all the periods through the various lockdowns we've had, and already talking around things such as enforcement, etc., which I'm sure will come up later, and comms, and you will have seen the communications that we did jointly with the police and other colleagues in terms of travel to and from the islands that was published last week. Everybody, I'm sure, and Rachel will go into more detail, I'm sure, is wanting to know about vaccination on the islands. Obviously, last time we were talking about the complexities of the Pfizer vaccine and how that might or might not get to the islands, bearing in mind the constraints on its travel. Obviously, Oxford has now been approved, and I'm sure is likely to be the vaccine of choice for the islands. Also, you'll know that we were lobbying whether or not the islands should be vaccinated as a whole, or whether we would end up with the tiers. That's still to be confirmed, as I'm aware. And obviously all of this is being led by our NHS colleagues, but my understanding is it's likely that we would be doing the first 4 tiers at some point over the next few weeks, but the dates are yet to be confirmed by NHS England, particularly when the vaccine becomes available. So as soon as we know, we'll give you the detail, but that's my working assumption. The key thing that I wanted the board's advice on really was communications and messaging. You'll know, and I've seen colleagues have sent me quite a lot of the Facebook messaging around second home owners, around contractors, etc. But the key issue for me, we needed to ramp up the messages about doing our bit. You'll have seen the Health Secretary last night on the news talking about that. And I think there has been a feeling that perhaps some people have got a bit used to flexing the rules as much as they can. This, of course, is a double-edged sword because the legislation is the legislation. We're not here to interpret that. That's the role of the courts. And obviously the police are doing their best to stick to their 3 E's, although I understand from Alison Hernandez on Friday that there is now more of a push to move towards enforcement where there are flagrant breaches. And also Alison said on Friday that where there are people seeing breaches, they should bring them to the attention of the police. The key issue I wanted the advice on the board, though, was comms. Because, of course, Professor Whitty has made it clear that in terms of outside your household bubble, you should consider everybody to be positive and therefore take all appropriate measures accordingly. And therefore, we need to think about that messaging. And also, you might not be aware, but the rollout of lateral flow tests is beginning on the islands now, starting with the school in terms of all employees, moving on to pupils. And Rachel might want to update later in terms of how we have wider access to lateral flow, perhaps talking with essential workers, say the air traffic controllers, pilots, refuse collectors, etc., etc. So the chances increasingly of us having positive cases on the islands, because when you look for it, you're likely to find it, are becoming ever more real. So I think the communications at the moment, we tried to adhere to pretty much what the government has said on its mapping process, which is where there are 3 cases or more, it shows on the maps, and therefore we need to do comms. But when it's less than 3 cases, where there are any of those, we don't tend to do comms. You remember that back in the September period, we caused some confusion in the community at that point. So the key thing for me is, if we do have positive cases that are less than 3, currently we would urge we wouldn't talk about it because of confidentiality. That's the government view, but that might cause angst on the island. If there were more than 3 cases, then we would talk about it. So the key point today is, I suppose, how does that land with our community when we're going to do more and more testing over the next few weeks, and the chances of the occasional positive are going to come ever more likely. So that's a key point for me. In terms of council services, this is a slightly different period, and we've been asked to keep the majority of council services open this time, such as the tip for Excentral, refuse, etc. Although I am still requiring the majority of council staff to work from home unless there's absolute need for them to come into the office. So I'm afraid it's still back to people working from home, which is causing its own pressures on all employees, and therefore I urge everybody to think about people's mental health and well-being at this time when people are looking again to another long period of working from home. So that's it from me. I think if it'd be all right from you, Chairman, to bring Tanya in, particularly to talk about how we're doing on the testing on the islands.
Yes, thank you very much, Paul. Over to you, Tanya.
Thanks, Paul. Thanks, Chair. So just to update you, our local enhanced testing service is working really well. As you'd expect on the mainland. So perhaps when tests would take 24 hours to come back, we might be looking a little bit longer, but currently they're still working for 24 hours, which is really good. We did see a slightly reduced service over the Christmas period due to poor weather and reduced flights. However, this didn't cause too much of an issue as we didn't have a significant demand for tests. Since the new year, we have seen an increase in test requests. However, to just put that into context, I don't know if you remember back when the schools went back in September, we had a huge demand for tests, and the increase in test requests over the last 2 or 3 weeks, or 1 or 2 weeks, has been much smaller. As Paul mentioned, we are supporting the rollout of lateral flow tests within the school and at Park House, and we're also exploring further how we can further support our critical infrastructure across the island. So we're looking forward to working with Public Health to determine how we prioritise, categorise and deliver these lateral flow tests. That's probably it from me from a testing perspective. I should just say that in terms of the lateral flow tests that we've been using in the schools and at Park House and some of those critical front-facing services, they are the very quick tests. They're the ones that we get a result within 20 to 30 minutes. And just because you come back with a negative result doesn't necessarily mean you don't have it. It's about an ongoing process of testing, and I'm sure Rachel will pick up on this in a minute. She's busy nodding at me. If we do pick up on any positive cases in lateral flow testing, we will immediately undertake a PCR test, which is the test that then gets sent to LISC for a confirmation result. That's probably it from me from a testing perspective.
Thank you very much, Tanya, and thank you, Paul. Do we have any questions from anybody, please, for either Paul or Tanya? No? Joel, Councillor Williams, thank you.
I'll go first. Another avenue of communication that I would like us to also explore is those people who have got medical health appointments on the mainland. I know there's certain anxiety. People might have routine screening. It might be an emergency evacuation. It might be chemotherapy or something like that. But I don't want people's health from another side to be conflicted by the sort of anxiety of having to go to the mainland. So if we could have some messaging that just explains, so we've got to look at health in the round, the precautions that they should take when they come home, those sorts of things. But I've had 2 or 3 people mention that to me, and I think they're fundamentally scared about going to the mainland. They don't want to be the person who brings it back and be patient zero, but at the same time they've got to look after their health as well. So, and that's just something I think we should be aware of.
Thank you very much for that, Councillor Williams. Councillor Grottick, please.
Thank you, Chair. I was going to keep my comments until item 5 on the agenda, when we're going to talk in general about comms. But since Councillor Williams has raised a very good point of people necessarily, and I hope they won't not go to the mainland for the treatment that they need, I think I would just mention now that if we have stronger messaging about what people should do when they arrive on the islands, that will be a key part of our stronger messaging that I believe we should be doing at the moment. In other words, asking people to go to the mainland. Don't be frightened about going to the mainland. I understand that Treliska and other medical outlets are really strong with their COVID secure measures. But when you get home, consider that you should be isolating for 7 days. And I think perhaps that's a message we should make more strongly. Thank you.
Thank you for that, Councillor Grottick. We will obviously... there's a couple of items that will include that coming up later. I think I will wait, unless anyone else has got any questions, we'll wait to hear Rachel's report before we discuss that a little bit further. I can't see any more hands up unless there are any. Please shout. So we'll move on to item 4, if we may, our report from Rachel, our Director of Public Health. Thank you very much, Rachel.
Thank you, Chair. So I wanted to start off by saying thank you to all of those on the islands for the response work that they do. They're exercising the incident response team, particularly Abby and Tanya, in terms of making sure that we exercise the plans for the Isles of Scilly and continue to roll out the testing, which Tanya just outlined earlier. Obviously, testing is one of the areas that's being expanded at the moment. And just to pick up the point that Tanya made about the lateral flow test, the very rapid tests, they will be more available, as we say, through schools and care homes, but there will be increasing opportunities to expand them to some other priority essential workers, which we're doing across Cornwall and Isles of Scilly. But just to sort of explain that they are less accurate at detecting people who are positive. So there is the sort of possibility that they're not detecting every case. So we have to always act as if we have been infected. And I think that's still the message, both for Cornwall and the Isles of Scilly, is act as if you could be carrying the virus, because that's the best chance. But obviously, the repeat testing does give the assurance that at that particular point in time, that person is less infectious. But we need to really be clear that when these tests are rolling out, that isn't the opportunity to relax the measures, become complacent because you've had that test that day. So lots of discussions over Christmas and the New Year. I've had a test of a various sort and changing behaviour, and I feel that that's the risk, is people feel they're suddenly safe and drop their guard. So very strong message that this testing is not the only answer. It's got to be part of all of the measures, public health measures, to prevent any spread. So thank you to the team, and continue to do great work, and clearly lots of effective work by the transport providers as well within for transporting people on and off the islands, and to do that safely. So recognise the efforts that have been made and successful way that's been done. So just to move on to give a little bit of an update on the situation on the mainland, as clearly things have changed quite dramatically from over the Christmas period, and I'm just sharing with the board some slides which I hope that you can now
see if that's come up. Just give it a little moment to connect. So I just wanted to show you the process of infections on the mainland since the lockdown. So that should now be visible to board members. So clearly, this shows that the lockdown and the reopening of the Tier 1 level in Cornwall from early December, you'll see that at the end of the graph, led to a dramatic increase in our rates in Cornwall from early December. So from very low numbers of sort of a rate of around 18 per 100,000 in a week on the mainland, we are now at a rate which is 341 per 100,000. So that is very dramatic, and clearly that is the impact of, on the mainland, the transmission through the tiered opening, the hospitality, the mixing, and then leading into the Christmas period, which then, as you'll see, we've had a doubling of cases in those weeks now, and we're glad to see now that there's a little bit of a levelling off, which we're just beginning to see, but we can't be confident that the lockdown will have quite the impact as it had perhaps earlier in the pandemic or in November. We have much higher prevalence now on the mainland, and we're likely to not be able to bring that down to those earlier levels. So we need people to really adhere to all of the guidance, which is our main approach on the mainland, obviously, as well as our case review process. But to put it in context, we've had almost 2,000 cases a week in some of those weeks over the Christmas and New Year period. So very challenging in terms of outbreak management, but we are working as hard as we can to ensure that those very sensitive settings, for example, care homes, are particularly prioritised. The rates that we have on the mainland are not attributable to one specific setting. So in the past, we've had quite big outbreaks in, say, food processing plants and those workplaces. This is community levels which are around household transmission, smaller cases related to smaller workplaces where people have spread between colleagues. So it's not just attributable to a couple of big outbreaks. This is across the whole of the community. But we do have some higher case rates in the areas across the middle of Cornwall, particularly Newquay to Truro. And I'm just showing now a map which shows the small area level rates. So we do have some hotspots of particular concern in some of the town areas, although this does change quite quickly. It's a daily map that's available on the gov.uk site. I do apologise for putting the Isles of Scilly in the wrong place on the map, but I couldn't fit it off the end of the peninsula there, so I've drawn it in a bit. So not reporting at that level. So we don't have one particular place. We have widespread transmission, but we are seeing a slowing. So that is really the summary for Cornwall, and our focus is, again, around engaging the population. We're doing a number of other types of Facebook Lives and media briefings and in trying to get the message out as consistently as possible and encouraging people to test. And we are having an increase in our rate of testing and the number of positives as a proportion of those tests that we're seeing. One other thing I think is to note is that we have much higher rates in the sort of 20 to 35 age bracket, which has been quite consistent over this sort of increased period. But we do have a lower rate currently than other areas, particularly in the southwest, for over 65. So we're really keen to try and obviously protect those that are most vulnerable. So we hope to not see a further increase in that older age group, which is most at risk, as well as other vulnerable people. So I think that's all I wanted to say, and I hope that's been helpful. No doubt the slides can be shared around. It's all public information. Thank you.
Thank you very much, Rachel. Have you got any news on vaccines for Scilly, please?
So I'm not leading the vaccination programme, but I do understand that plans are in place and that your GP practice will be leading the rollout, and that people will clearly get the information from the practice and should be waited to be called, and that will be on the basis of their priority groups. So that will be very important that it is healthcare workers and the over 80s that are the first priority groups, and obviously as that's rolled out, and the Oxford vaccine, the AstraZeneca vaccine, which of course can be transported more easily, as you've discussed previously, obviously is a very welcome development for the Isles of Scilly in terms of that rollout.
Okay, thank you very much for that. And before I go to questions, I would like to add my congratulations to you, as Paul mentioned, for your appointment, Rachel, and to thank you very much indeed, along with Dr. Whitney Cummins, for all the help and support that you continue to give us. Thank you. Do we have any questions, please, for Rachel? No? Joel, Councillor Williams, thank you.
Yeah, I was just going to ask about hospital capacity in Cornwall and Devon. Is it, obviously your graph was quite stark, is that infection rate manifesting itself into hospital admissions at this point in time?
So yes, there have been an increase in hospital admissions with COVID. So I mean that's certainly the picture across the whole of the southwest, and the hospitals in Cornwall haven't been as affected as some of the other areas. But clearly they will be enacting all of their sort of surge plans to ensure that they have the extended capacity that they need. But I can't really comment on specifics around the NHS in my role, but obviously there are people across all of the hospitals adjacent to Cornwall as well that have seen an increase in COVID admissions.
Okay, thank you very much. I don't see any hands up.
Chairman, if you wanted to expand on Rachel's point for Joel, Paul here, this was discussed also at South West Chief Exec's meeting and at the Cornwall and City Leadership Board on Friday. And as Rachel said, whilst there are an increasing, worryingly number of increasing cases of positive patients in Trelisk, it is not unmanageable at the moment. I think we're worried about the next 2 weeks, particularly. But of course, what we also need to remember is that whilst colleagues across the country are in difficulties, the issue of mutual aid is being discussed. Mutual aid is where hospitals help out other hospitals. So it may well be that those areas that don't have the high numbers are asked to take patients from other parts of the country to help spread the load. So it might not just be a local issue, Joel. There may well be national pressures. And you'll have heard Professor Whitty last night as well in saying that the next 2 weeks are the weeks when we're expecting to see the peak.
Okay, thank you. Councillor Legg?
Thank you. Is there any evidence to show that the sort of average age of hospital admissions is coming down from the first wave?
So looking at Cornish patients, no, that there doesn't seem to be, but clearly there'll be that analysis at a national level, which might give us a better indication. But I think what we might see, because of the higher prevalence within the sort of working age population in general, we might see more people, because they've been more exposed, that will be hospitalised, even though it's a lower proportion than if it was in sort of older age groups. If you see, so that widespread exposure will mean that there will be people of age, if that makes sense.
Thank you.
Thank you very much. I don't have any other hands up at the moment. Was there anybody else wanting to come in at this juncture, please? No? Okay, well, thank you very much, Rachel. We have got communications as the next item on our agenda, but I would like to just mention a couple of issues before we come to comms, because I think the comms conversation might centre around these issues as well. It's quite clear that we have two particular concerns on Scilly at the present time. One is second homeowners and the number of second homeowners that are visiting Scilly at this time. Obviously, government legislation states that they should not visit their second homes at the present time, that they should stay in their principal residence. However, there is some difficulty around the fact that people are allowed to go to work, and it seems that some of the second homeowners are deciding that they need to travel to their second homes to do work. Whether it means, as Councillor Sims very clearly put it the other day, sticking a roll of wallpaper in your holdall when you travel to Scilly, or whether it is seriously carrying out work, it is a big concern. And I would think, in my own opinion, that they perhaps should be considering using our local tradespeople to carry out work. But as Paul pointed out earlier, it's not up to us to interpret the law. It's a very difficult situation, and I'm sure Darren will come in a moment. But it is a big concern for our community, and we need to look at this concern and see if there is any way that we can keep some kind of control over this, so that the virus is not brought in by second homeowners. And the other point I wanted the board to consider was a COVID-safe strategy for non-essential works. Again, it revolves around being allowed to do work, but the question remains around the number of contractors that are coming from the mainland. Yes, we need to get ready for our season so that our economy can start again in Scilly, but we have to be safe, and we are in a national lockdown. I don't need to tell you. I think as Rachel mentioned earlier, that the transport providers are doing a very good job to help in this and questioning people. And I know that, for example, South West Water contacted me the other day and said that they had workers coming here but wanted to reassure councillors and the community that every possible precaution was being taken by their workers. They were being tested before they came here, and they were operating in a very COVID-safe manner. So, they clearly are taking this seriously, and we would hope that all contractors are taking it seriously. However, it is still a big concern in our community, and I think our comms need to perhaps look at this, and we need to try and put out a clear message that obviously essential works must happen, but it's a little bit like the saying, you can do it, but do you have to do it? And we need to try and push that message out. I believe that we really need to get to the bottom of what is essential without trying to interpret the law in our own way, which clearly we're not allowed to do. So I see your hand is up, Darren. We will move from this straight into comms, Tom. So let Darren speak, and then we'll go into comms, and people can talk about this subject under our comms agenda item. Thank you, Darren.
Thank you, Chair. I thought it was probably the best time to come in there in the meeting, probably to in direct response to your questions and the points raised, and also to give you a bit of a policing update as well, to hopefully give some assurances to what we're doing in relation to those issues. So I think if I answer your second point first of all, and specifically focusing around travel, whether that be contractors or second homeowners coming, something that we're seeing on a national level, and the reason for my lateness this morning is because I was actually on a silver meeting where this was raised again, is that that term essential, that's the fundamental missing aspect in this lockdown, version 3 from version 1, and as such what we've found is is people making their own interpretation of what is and what isn't work, or what is and isn't essential, I should say more accurately. But from a policing perspective, and I'll go through it a little bit more, we do continue with the 4E approach, as Paul alluded to, but there is now a specific drive from the National Police Chiefs Council towards quicker enforcement, and that's in direct response, really, I think, to the infection rate rise, and also to attain that public reassurance. And what I can see locally, since the new lockdown was implemented, we've had, and we record all of our engagements, so we've had 33 engagements here in the police station, i.e. 33 contacts from individuals, homeowners, second homeowners, business owners, asking questions about can we travel. And I know that it's a really relevant point, and it's going to be a discussion point in this meeting about public perception around second homeowners. But, what I would like to stress to the board is there is a distinct disparity between what Facebook says, which is an ill-informed opinion, to what the actual result is on the ground. What I can say of the 33 engagements we've had and notifications around people that shouldn't be here, we follow up on every single one of them. And if it involves a local visit, we are doing that local visit. And the conflict that we have got here on the island is one that's echoed across policing nationally, is where does encouragement stop, or education and encouragement stop, and enforcement begin? And because of that lack of clarity from the central government around what work can or can't be done, if somebody essentially says that they are here to work, albeit in a second home, but they're here to prepare a second home for the upcoming season, again, we've got to manage that issue, which is very complex and extremely difficult, which I hope you can appreciate. But to give some assurances, what I can say is, obviously last week we worked in conjunction with the council and Skybus, where we got that one collective message out there. With Skybus and their reassurances around their booking system, that they're vetting individuals coming onto the island. We're also meeting all flights coming onto the island, today excluded because of these meetings, where we're challenging anybody that we don't recognise. And if they don't meet the exceptions that are listed in guidance, then they are being encouraged to leave, and those that don't leave, we are then going to enforcement, of which we've had 2 in the last week. Which leads me on to another point, and again for awareness, which is an issue that I've raised with Gold this morning, is because of our unique situation on the islands, something that we've been faced with is individuals that are subject to enforcement and being given an instruction, a lawful instruction to leave the island, are then responding by saying the risk of infection is far greater on the mainland. I am here, and I don't want to go back there because of the risk of infection. Now, I can imagine what everybody's thinking when I say that, but I'm just trying to put it into context. So now we're stepping into the realms of a human rights issue on can we lawfully order someone to leave the island to go to somewhere where an infection rate is known to be higher or more prevalent. That, as well as another issue that I've raised with Gold this morning of individuals being here, whether it be in second homes or otherwise, prior to the lockdown being invoked. That question I've asked of Gold is, can we lawfully instruct and order that individual to leave here if they were here prior to the lockdown being implemented? So that's some of the issues we're dealing with locally. I do absolutely believe that we are doing everything we can. I've got my team in on overtime now. There's only 4 of us to meet the demand of this through engagements, flights, and other policing commitments. But I think we are in a healthy place, but I do recognise what the concerns are. But I would implore everybody to encourage our community that rather than taking to Facebook and subjecting the community to opinion, which often sparks then a snowball effect, is use the correct reporting mechanism and contact us, because I would like to give the board assurances that we are following up on each and every one of them. And if enforcement is the answer, then that is what we are willing to do. That's it. Thank you, Chair.
Yeah. Thank you very much, Darren. Very wise words, and understand everything that you're dealing with, and thank you very much for your assistance to us in all this. And I too share your concerns about messaging on social media, and hopefully, Tom, you've heard all that as well. When we come on to comms now, we can perhaps get some of these messages out and try and reassure people that the real messages are going to come from us and from the police, and that they shouldn't engage too much in speculation. So anyway, I will hand over to you now, Tom, if I may, please, on comms. Thank you.
Thank you, Chairman. So early on in the meeting, the Chief Executive did an excellent job of summarising some of the comms activities and concerns, as well as some of the messaging we put out last week. Obviously, probably most people on the meeting, I hope, will have read the joint communication with the police and the steamship company around travel to and from the islands. So this was covering a few points from the ongoing need, and I think it is worth emphasising there is an ongoing need for contractors to come to the islands. We have important water contractors who we rely on as a community, and I think everyone would agree we don't want to discourage these vital contractors to get onto the island. We don't want to make them feel uncomfortable while they're here, at risk to themselves, let's be honest. So, that's a message we've tried to get out with the police and with the steamship company. The other messaging was just to get across, if it wasn't clear, what the police are doing and what the steamship do proactively at both ends. So the steamship routinely ask your reasons for travel, as do the police, and the police are proactive at both ends, at Land's End Airport and also at St Mary's Airport. So, we were really impressed with what they were doing. But as Darren put across there, a comment on social media doesn't amount to reporting something to the police. So if you have a genuine concern, whilst you're free to air...
This meeting is being recorded.
Followed up by the police. So do get in touch directly with the police if you do have a concern. That's, overwhelmingly what Darren's saying. And he and his team are responding to all the requests. There are quite a few, but they're managing to get through them, follow them up, and they have a much better feel for the numbers of people on island. And whilst they're always concerned, I think it's fair to say, Darren, and you can correct me if I'm wrong, you're not unduly concerned with the numbers on islands at the moment. Would that be fair?
Yeah, that would be absolutely fair. Like I say, I think that the disparity, once social media takes hold, and we know the island loves social media, it can spiral out of control, and sadly that forms an opinion, which is hard to move people off that opinion line,
Yeah. So whilst we can obviously put out further messaging to the effect of, reasons for travelling to the island and what might be a legitimate reason and what might be maybe stretching the rules a little bit, I do want to just stress we will also be supporting the important contractors who are vital to the islands to come over here, and we do need to respect the fact that they have a job to carry out. Paul also reflected on the government's position at the moment that regardless of the number of rules that they apply and how strict the rules are, our main issue is making sure that people follow those rules. So there's an emphasis on people taking personal responsibility to do the right thing. The virus, as we know, produces a very large proportion of asymptomatic cases. So as Rachel mentioned earlier, even if you felt like case numbers were very low, you should still continue to act as if you're likely to come into contact with someone, because you wouldn't necessarily know. And what's different between now and in March is obviously case numbers in Cornwall are very high, and inevitably that increases the chance of transmission to the islands. So if we all continue to act as we are, and I think everyone would agree that people on Scilly are very good at following these rules and respecting them, but if we continue to do that, we do reduce our chances of the virus getting here, and if it does get here, the chance of that spreading are much reduced if we all continue to follow those rules and sort of take it really, really seriously. Now, Councillor Williams mentioned an interesting point, and we will pick up on this, Joel, which is the balance between urging people to be careful about travel and also not completely discouraging travel. So I mentioned contractors on the one hand, but you're absolutely right. If someone has a very urgent medical appointment on the mainland or something they're concerned about, you are allowed to travel for medical reasons, and we encourage people to travel for medical reasons. I'm sure. I don't know if Rachel, do you want to come in on that?
Thanks. I think we have covered it earlier, didn't we, in terms of not wanting people to delay or not access any urgent medical care, both either from on the islands or off the islands in terms of their appointments. It's really important that we don't have a sort of further impact on health as a result of people not accessing the services they need, in addition to COVID. So yeah, I think we have covered that earlier, but yeah, happy to reiterate that point really.
Yeah, so we can certainly pick up on that in more of our communications activity, but that's clearly advice from public health is to not delay those urgent appointments. Councillor Grotte mentioned something about, I think the idea was that it would be a sort of informal suggestion that anyone who has had a mainland appointment isolates for 7 days on their return. Was that correct, Fran?
Yes, I think this would help encourage people that they could safely go to the mainland and not be a danger to their fellow islanders. So I just thought it might prove to be a valuable reinforcement. I imagine that Rachel Wrigglesworth would approve of that.
So I think the first thing to say is we can only ask of people things that are within the rules, but I'll let Rachel speak to it in terms of what the informal advice might be from public health.
Yeah, I mean, in terms of what our current advice is, it's stay at home. So essentially, if somebody should be within the current lockdown period, be only leaving home to do that essential food shopping or walk or exercise, whatever that choice is. So essentially, that is limiting all contact. That is almost as strict as obviously the guidance says that we should be. If you wanted to introduce something as strict as that would be an additional measure that you have decided to do. I wouldn't suggest that is enforceable in any way. It would obviously be on the advice to you, from you to islanders. But we're certainly re-emphasising the importance of the staying at home and not having interaction with other households, which should, in effect, have the same impact. And obviously, if they do go into shops, they're keeping distance and wearing the face coverings and washing their hands. So essentially, that should have as I say, the similar impact as not strict quarantine, but certainly reducing as far as possible contact with other people you don't live with.
Thank you. Tom?
Thank you, Chairman. So that's all from me. I think that we've covered the main issues, but I'm happy to obviously take any questions.
Thank you. Do we have any questions, please, around comms? Councillor Sims?
Yeah, referring to the last point and Fran's point, whilst I think we seem to get hung up about making recommendations. Start again. There's a difference between a recommendation and a dictate. And if we made a recommendation that people did that when they come back from the mainland, I don't really see that as an issue. It's an extension of the guidelines as opposed to our interpretation of them, really. And I would have thought it's quite sensible. And regarding second homes, now, the issue seems to be everybody thinks they're an individual and everybody thinks they're different to everybody else and they're probably safe. Now, lots of people coming over here, it probably is perfectly safe, or this is going to fly everywhere. But if you're in the aggregate, it's not safe, it's deadly. And I think that should be part of our messaging. That 1 or 2 2 people, it may well be okay, but the more people you get, then eventually, statistically, it inevitably becomes deadly. And I think that's a fairly forceful line to take. So I would like to see something like that in our cars, because ultimately people can die because of this, and sometimes it can become a bit ordinary, and you're sort of talking about it in a somewhat abstract way. But the bottom line is that people will at some point die if people aren't careful enough.
Thank you. I have 2 more people, I think, waiting to come in, but I can't see. Yes. Councillor Legg, thank you.
Thank you, Chair. I just wanted to ask the Director of Public Health if she'd seen or heard anything about the cases on Shetland, because I heard, I think it was a professor talking on the radio the other day about how the cases there and the local transmission there started with just one person coming to the island. And I think that's a perfect example here of how one person being a little careless or even completely unintentionally bringing it to the island can initiate that public community transmission. I just wanted to check to see if you had heard anything about that.
Thank you for that question. I mean, I haven't got the detail, obviously, on that particular sort of case.
I appreciate it.
You know that the Isles of Scilly and public health members participate in an islands COVID sort of communication group, sharing good practice. So I imagine that would have been shared. And clearly it's the same in any community. That's how the sort of transmission is seeded, is from that index case across a whole variety of communities. But I take your point, and I think I'd go back to my message around we should all act as if we, could be infected. I think that's a very clear message. The Chief Medical Officer is clearly directing that areas that have higher prevalence. But, we don't know if we could be that one case, do we? So I think that's, wise to consider yourself to potentially be infected. Take all of the precautions that you can to prevent that. And that will, hopefully put some barriers in behavioural barriers in place to prevent any onward transmission. And as soon as, obviously, self-isolation, staying at home, all of those things are going to, obviously, as well, reduce the opportunity for it to spread. So, thank you.
And then Darren brought up the point of returning people to the mainland is returning them to somewhere where there's a higher rate of infection. Now, we can never actually know the true rate of infection on the islands at any given moment. There's always a delay. So just one case on the island would mean a very high rate of infection considering the low population. So therefore, at any given point, we may actually be at a very high rate of infection on the islands. So no one could for certain say it is safer here than anywhere else. Is that fair to say?
Do you want to come in, Rachel?
Sorry, I wasn't sure if that was directed at me. I think that clearly people are being tested. So there is sort of any detection of any cases, people will be self-isolating. Obviously, that's if they've been tested, and testing has been going on in the island. So obviously, if anyone will test positive, we would expect them to be staying at home very strictly for the self-isolation periods, and we have all the measures in place to ensure that happens. So that's sort of first of all, if anyone does test positive, we will be aware of them. And clearly, I think the other is the behavioural issue, which I've already said around. We would act as if it could be there, but it's certainly sort of say not the case currently in terms of.
No, I appreciate that, but for example, if it had arrived here yesterday, we wouldn't necessarily know yet that it had, and that one case that has arrived would put us at a very high rate per 100,000 due to the low population.
So you're right that if someone arrives or has asymptomatic carriage, that you're right that could be something that is not tested or detected. So I think, that is a correct statement. I think, the behavioural, issues again come into play around, we encourage people to act as if they potentially could have it to prevent that. So, yes, I guess you're imagining a scenario that's an escalation of obviously where we think we're at now.
I think my point is that we're not any safer than the mainland. We should assume that we are no safer than anywhere on the mainland, and we should behave as such.
I agree. I think that you should do that, and I think that's what the message that I'm trying to get across. Not to be complacent, but clearly from the testing that is carrying out, the islands do not have the sorts of prevalence and numbers of cases that we are seeing in Cornwall. So I just want to correct that statement in that sense.
Okay, thank you.
Thank you. Councillor Grottick.
Thank you, Chair. I'd like to ask the Chief Executive a question in a moment, but if I could just give a bit of background. Several councillors have been reminded by an islander that we have a collective corporate responsibility to the community, and I think we're all very aware of that. And we've also been asked if it is possible that we could set a COVID-safe, non-essential work strategy so that there would be some more clarity around the issue of what is essential work and what isn't. Now, I know this will be incredibly difficult, but on the other hand, I don't think it's just selfish to ask for stronger guidelines, since if we do have COVID over here, we're going to be incredibly resource hungry and put a lot of strain on an already difficult situation within the NHS and indeed within the transport system. So my question to the Chief Exec is, I'm sure we have, an ongoing political dialogue regarding the difficulties with the latest set of instructions, which the Chair has enumerated for us very well just recently. Is there a continuing dialogue around, especially as Darren has said, the lack of clarity around a couple of the wording statements? And is there any chance that our local MP, who is a very proactive local MP, could actually help us in this regard, or indeed one of the other forums on which the Chief Exec sits at the moment? Thank you.
Thank you, Fran. That's a big question. I think I would start from the premise of the law is the law. And I think, as the chairman said at the beginning, it's a dangerous path for us to go down to try to think that we can interpret the law as deems as fit. And that's a little bit what Darren was talking about earlier, that ongoing dialogue around where there is unclarity or vagueness in the legislation is continually being picked up. You'll have heard today, you'll have all heard the story of the two ladies who were fined in Derbyshire for going 5 miles from home, and yet today the Prime Minister was caught 7 miles from home on his bike. One was deemed to be okay, one was deemed not to be. So therefore, even the Prime Minister seems to be at odds with the legislation in terms of what the police did in Derbyshire, which was backed up by the Home Secretary. So I think all I'm trying to explain is that there is confusion in some of this, where the legislation says things like reasonable or non-essential, what does that mean, or stay in your locality, without defining what your locality means. But to answer your question, Fran, on a number of points. Number one, we are very active in liaising with all the contractors to make sure that we can give them advice and help when they come to the islands about making sure they're COVID secure. And I've not come across any yet that have not been doing everything they reasonably should to protect both the islands and themselves. So I can give that assurance that we continue to do that onward dialogue. In many of those areas we have no enforcement rights, but we are absolutely going over and above. And they've been quite happy to share their self-assessments with me. They've been over and above in terms of COVID testing that's happening on the mainland. So I've not seen contractors not complying properly with the legislation as far as they can. In terms of confusion in the legislation, I think that Darren himself talked about the confusion about the Human Rights Act versus the COVID legislation, and Harry obviously has tried to explain the point around, well, are we any different from the mainland? I think all these things, though, if we're not careful, can be distractions. We should come back to the core message. We're in a national lockdown position. We can all find reasons where there are greyness in the rules, but it's pretty clear, unless you've got a really good reason, stay at home. do one exercise a day locally. Treat everybody that's not within your household bubble as a positive contact that you should work 2 meters away from, wear face masks, etc. We're back to the good old public health messaging. And if we can just stick to that, that would be the best we can do. But I can absolutely assure you, Fran, that we will continue to try and identify areas of greyness and take them up through all routes to try and get clarity.
Thank you. That's very helpful.
Thank you very much, Paul and Fran. Darren, you've got your hand up, I think.
Yeah, thank you, Chair. I just wanted to pass my thanks to Paul. He eloquently put that much better than I ever could. And I agree absolutely. But I do think, and further, to what Tom was saying and to what we're trying to achieve, I think we collectively as an island, I think our real emphasis should be on just repeating everything that Paul has just said, and driving towards that message that we are as prepared as we can be. In the event of any circumstance, we are fully prepared, fully tested. We've got our multi-agency forum that tests out these scenarios. So just really reinvigorating that reassurance to the community, because as we all know, quite often it's lack of information or lack of awareness which drives people being unsure. And then when people are unsure, then they start to speculate, which puts us into the positions that we're trying to manage now, isn't it? So that was it. Thank you.
Thank you. Councillor Williams.
Yeah, thank you. I'd like to go back to the point we raised earlier about vaccinations. And I was wondering if there was any intention after this meeting to put together some sort of formal statement to say what we know, just to reassure people. But I'm also mindful that perhaps one of the target groups of 80s and over might be the least likely to see it on social media. So I don't know whether it's our role or we're doing it via the clinical health professionals on Scilly. But I think a lot of people are going to be asking the question, and even if it changes, it might be reassuring for them to know that those conversations are taking place. I was just wondering what our role as a board was regarding that.
Shall I come in, Chairman?
Yes, please, Paul.
So, Joel, I'm absolutely with you on this. I mean, the Chairman and Vice Chairman were at a meeting with me on Friday where we were given further information on vaccination, but again told that until it was confirmed nationally, we weren't allowed to share it more widely. This is absolutely, and I must reinforce this, the vaccination programme is being organised, run and communicated by the NHS. The Council is here to assist and to support and to be alongside wherever we can to make sure that we can assist. But we're not in the driving seat here. This is a national programme being rolled out nationally. We're pushing for communications to come out as soon as we can. I'm hoping, Joel, that it will be this week. I really am. But at the moment, I'm told that we're not allowed to commute anything until it's signed off by NHS England. That's the current route. That was reinforced to us on Friday with the MPs. That's being challenged about we need more local flexible comms. And Steve Double, who I understand now has a role in the Department of Health, was going to take that up himself. But currently, the comms are controlled by the NHS, Joel, and we have to wait until we're allowed to communicate. I think probably what it is they don't want to say something and then find out they don't hit a deadline. I think they want to sort of make sure that they don't promise something and they're absolutely guaranteed to deliver it. But my gut would tell me that we'll be able to say something this week, and then we'll share it instantly with this board and onto the community.
Thank you. Thank you very much. Do I have anybody else waiting to come in, please? John May. Thank you, John.
Thank you, Chairman. If I may, I'd just like to make 3 or 4 sort of observations more than anything else. First of all, I think vaccines, vaccine is the game changer, and we shouldn't lose sight of that. And it is just around the corner now, and that should be foremost in our minds with some of the communications that we make. And for example, with Councillor Grottick's first point about hospital visits, obviously people should be encouraged to take essential trips to hospital on the mainland if they're needed, but routine visits it may be an opportunity to postpone those, because there are stories coming out now of our West Cornwall hospitals where people have it is not the most COVID-safe place that we would like to think they were. People are going in. There are stories and information coming out of contagion happening within the hospitals. So those routine visits can be delayed until after the vaccine. That would have seemed sensible to me. Darren's comments seem eminently sensible to me. But one observation I've got is that the government guidance under the heading staying away from home overnight does not make any exceptions for second homeowners to come over, even for work on those properties. Ironically, it would seem to facilitate tradesmen coming over to work in those properties, but not the second homeowners. And that might wheedle out some of the the concerns that, or the reasons people are giving. And lastly, well-run businesses, commercial businesses, will have a desire and a need to make sure that they are ready to operate when the season starts. And I think it would be wrong. They've got to do it within the law. They've got to do it with prudence. But the later that can be done, with the vaccines being rolled out, so much the better. So, obviously we don't know when we're going to open, but if a lot of that work could be encouraged to be carried out as late as possible, the more vaccines would have been given, and the clearer the picture will be. And perhaps, again, for communication, something along those lines may be helpful. That's it, Chairman.
Thank you very much, John. Councillor Legg, please.
Thank you. I believe earlier, Robert, you may have mentioned sort of seasonal staff and that sort of thing. I know one of the permitted reasons to travel is agricultural work, and it's the time of the year when flower picking is in progress on the islands. I just wondered if we might put something out just encouraging employers to advertise jobs locally first before inviting seasonal workers from further afield. Obviously, as has been mentioned, we can't enforce that, but as an ask, it would seem good practice to do so. And the same could be said of the work that is needed to be carried out on accommodation, that the job is advertised on the islands first. I don't know if anyone could come in on that.
Paul, do you want to come in?
I think probably the best thing to do, Harry, is I'll take away all of these things and talk to Tom about how we can wrap it all up in a further comms. I mean, absolutely. I mean, it needs to be that balance, doesn't it, between ensuring that people who legitimately can go about their business are allowed to without feeling hounded, that we think about the economy of the islands as best as we can and balance that against protecting our residents as best we can. So, I mean, that one, I think, employing locals has got to be a good thing to do, hasn't it? But there'll be many occasions when that's not possible. If you remember, I hate to bring up the B word of Brexit, but you'll remember all the same thing about employing local in Cornwall. I think they had 3 applicants out of the sort of 10,000 they needed or something. I exaggerate to make the point. But I think, yes, we can wrap some of these messages up and put them round for you all to have a look at when Tom and I have a chat about it.
Yeah, thank you, Paul. And I'd just like to say from the chair, I think, there's been some very useful suggestions from many of you on the board today. It's not easy to agree exactly how we deal with those, but I think suffice to say, as Paul says, we take these all on board, and we will make sure that as far as possible, your very sensible suggestions are dealt with and put forward. So thank you for all the input. Councillor Sims, please.
Yeah, just one thing regarding what John said about the virus. Now, I totally disagree with that. I think that what we need to do is just carry on under the assumption there is no virus, that there is no vaccine rather than virus. Carry on under the assumption that there is no vaccine, because that's basically the case at the moment for most people. We're in a much worse situation now than we were in March, April, and the vaccine is a safe harbour, but it's not a safe harbour for months yet. So it's far better for people to continue as if it doesn't exist.
Okay, thank you for that. Tom Walton, please.
Yeah, just one quick point of clarification. So there's been a lot of requests for messaging to go out, and I'd just like to get across to everyone that in some of these examples that have been raised here, we'll absolutely entertain the idea of putting the message out, but in most cases, the council needs to take a position first. So the council, in some of these cases where it's, for example, informal advice to the public that isn't contained in the guidance, we need to be really careful that there aren't any unintended consequences to that. So, it is a conversation between me and Paul, but also the wider partners, such as public health and the police, before it then turns into communication. So it isn't just a step from the suggestion to comms, that, the council has to take a position first. And in some cases, whilst we might personally agree, there are sometimes reasons why we can't take that position as a local authority, and we have to sort of pass on to a partner or, whatever the case may be. So I just wanted to be clear that it can take a bit longer than it might sometimes seem.
Yeah, thank you for that, Tom. But as I was trying to say just now, I think the main thing is that all the concerns and suggestions are being taken on board, and we will disseminate how that can be dealt with from there. Stephen Taylor, please.
Yes, thank you, Chairman. It's just picking up really on what Paul said, that there does need to be a conversation as to what we issue in the name of the council, just to be clear that this is authorised by the council, so that we are very clear whose advice it is, and the level of detail that we're going to go into. Because up to now we've been kind of circulating, repeating government legislation and government advice. If we start saying, well, we want to impose our own level of isolation, or we want to impose our own restriction of movements, then of course we want to make sure that we got the council behind us on that.
Thank you very much for your advice, Stephen. John May, did you want to come in again, please?
No, sorry, I didn't mean to have my hand up.
That's okay, thank you. Anybody else waiting to come in, please?
Sorry, Robert, if I may come in again?
Yes, thank you.
I just wanted to ask, and no one may be able to answer this, I don't know, perhaps Darren might have some insight. Extended support bubbles are obviously very important to some people, because if you live alone, then at this time when we're supposed to be staying at home, then that leads to incredible isolation. If someone has formed a support bubble with someone far away, let's, for example, say that they live near London, I would assume that travelling to see them would be non-essential. Like I say, I don't know if anyone has any thoughts on this, any insight.
Stephen Taylor?
I think I would have to check on this, but I think from memory, the regulations say that you are allowed to travel to your support bubble.
Yeah.
I don't think it actually gives any distances, but there is a conflict in the regulations, because of course you aren't meant to be away from your home, but you can, from memory, I would have to check if it is a support bubble.
Thank you. Darren?
Yeah, thank you, Chair. Stephen, yeah, I would echo that. I think I know the case that you're talking about. Harry. And that is another question that I have asked of our gold command is what is or is not reasonable. But I think Stephen was absolutely right in that it isn't defined on the distance within which you can travel in order to form your support bubble. Very frustrating, I know, but again, we can only work within the parameters that are set.
Just clarity, I didn't have any one individual case in mind. I heard of several cases, but I didn't have any individual in mind.
Okay, thank you for the advice anyway, Darren. Steve Sims, please.
Yeah, on that subject, I mean, I've never really got a clear understanding of support bubbles. I mean, it's a pretty informal thing, isn't it? You can, I mean, from Darren's perspective, somebody could say, I'm just going to see somebody in my support bubble, because, and it could be anybody at that point, couldn't it?
And sorry to come in there without my hand up, but yeah, and this, I'm glad that this has come up, because this is introducing the board to some of the challenges that are being faced by policing on a national level, not just unique to the island. In that, yes, individuals are interpreting what they can and can't do to suit their individual need, which is not necessarily within the spirit of lockdown. So we've got the legislation side of things, and then the spirit of lockdown, which sadly there is a very small minority of people that will manipulate the situation to suit their individual gain.
Thank you. Stephen Taylor?
Yeah, and I would echo that, what Darren says. The regulations are relatively clear on forming support bubbles and who can be in a support bubble and what happens when you try to change your support bubble. So they are quite detailed, and that might be something that we just need to make sure that, if asked, we have a response to. But the word support bubble, if I remember rightly, is not in the regulations. Is it an associated household or something like that? But I would have to check on that, because it's quite a detailed point. And as the local authority, not the enforcing authority, is not one that's been top of my list of priorities at the moment. But I could always work with Tom and the Chief Exec and Darren on that if that's what the board would like.
Thank you, Stephen. I do think it's something that needs some clarity, and I think it may well be something that Paul and Tom, we can work on in order to give people, the government guidance on that, just to reiterate what that guidance is as we know it, just so that people are a little bit clearer about it, because there does seem to be, as has been pointed out, some grey areas. Thank you. Anybody else wishing to come in, please, on comms? No. Well, thank you very much. We move on to the last item on the agenda, which are any other business, any other items which any of you may wish to bring forward, please. I don't see anybody waiting to come in. Have I missed anybody? No. Well, thank you all very much for a very useful meeting. We will take everything away and hopefully with our comms and so on move forward on a lot of things which we've discussed today. So thank you very much indeed, and I'll close the meeting. Thank you.